Imagine for a moment that you are drowning but you feel too ashamed to ask for help, fearing that people would blame you for falling in. This is how some people struggling with substance use disorder have described their experience. The reality of this issue is that the way many people view addiction and the people living with it shapes the treatment they receive and its quality. We must change the way we view substance use disorder and the people who are dealing with this illness if we are ever able to hope to break the cycle of addiction and the stigma that comes with it. This means recognizing the flaws in many of our current systems as well as acknowledging the potential in people who are struggling with addiction. Let's first talk about why treatment can be difficult to access. According to the results from the 2023 National Survey on Drug Use and Health by the Substance Abuse and Mental Health Services Administration, 54.2 million people aged 12 or older in 2023 were classified as needing substance use treatment. Only about 1 in 4 or 23% got the help that they needed. There are many reasons that people don't receive the treatment that they need. Affordability, stigma, and fear of treatment are the major ones. The treatment received may not work the same for the next person. Some cases are more or less severe than others, and not all treatment centers are the same. Some offer higher quality services, and some people already dealing with addiction can't afford them, or their insurance doesn't cover the treatment they need. And the location matters as well. Some people can't afford going out of state if they need to, or take time off of work. Many people assume that treatment is readily and easily available, and the reality is far from that. There are some positive notes to this. Insurance companies are changing their amount of coverage for treatment, and that may open the door for a greater number of people. There are some innovations that help people who need help in farther or more remote areas, such as telehealth, a virtual form of healthcare. According to the American Addiction Center's website, virtual healthcare can aid with online therapy and counseling and medication management. Additionally, there are free alternatives such as 12-step and other self-help programs, which are widely available and can get you at least some form of help. While these services are available, not everyone benefits the same from them. Like I mentioned earlier, the treatment received may not work the same for the next person. Treatment should be individualized because each person has their own unique experience with addiction that is shaped by different factors in their life. Treatment can't be generalized because everyone's case is different. Personalized treatment plans would be much more effective to make sure everyone's individual needs are met. There is also the quality of treatment centers that plays into the issue. The way many centers work is that an individual will check into the facility, receive treatment for a couple days to detox, and then they are left on their own. This has been the norm for a while now, and it has been very ineffective. Addiction is a chronic illness like others such as asthma and hypertension, but it doesn't receive the same amount of long-term care. According to the National Institute on Drug Abuse, 40 to 60% of people treated for substance use disorder will experience relapse, and this actually increases the chances of overdose. These chances increase the longer amount of time that passes after the initial treatment, and according to Rajit Sinha in the article New Findings on Biological Factors Predicting Addiction Relapse, 85% of individuals relapse and return to drug use within 1 year of treatment. So knowing this information, the short amount of time care that many addiction centers provide is not enough to help these individuals. Many cases have also surfaced in addiction or rehab centers reporting abuse and neglect of their patients, which leads to a widespread fear of these centers that are supposed to help you overcome an illness. This leads to individuals fearing getting treatment to begin with. There are many cases of rehab centers that are not up to standard, offer ineffective treatment, and have an overemphasis on profit. These types of facilities take advantage of their patients and offer little to no progress in return. Some have unethical practices, and because of these stereotypes, many individuals rather steer away from treatment. Affordability and access aren't the only factors preventing individuals from seeking treatment. The other part of this issue, and perhaps a more difficult one to fix, would be society's view on substance use disorder. By changing the stigma that follows addiction, more people would be inclined to seek treatment. Many people, when they hear the word addict, they will think of the worst situation possible. It is not a flattering view. People often think of someone on the street, criminals, or someone unreliable. Many times, struggling individuals are dehumanized. Because of how addiction is portrayed, people are often reluctant or in fear of coming forward and asking for help. The truth is, anyone can be affected by addiction. It can affect any age group, race, or profession. It can be difficult figuring out what these people are struggling with. The word addict comes with many unfair assumptions that overshadow a person's humanity. People fear they will be judged or criticized or marked for life because, for some, even after receiving treatment and overcoming the struggle, the stigma of addiction never fully goes away. Even though substance use disorder is a medical illness, it often isn't treated that way. Unlike other health conditions, it's more commonly viewed as a shameful, self-inflicting choice that doesn't deserve proper care. According to Johns Hopkins Bloomberg School of Public Health, drug addiction is viewed much more negatively than mental illness. Mental illness has begun to receive more awareness recently, but the stigma around addiction remains unchallenged. And even though both of these conditions go hand in hand, addiction is still judged more harshly. This is a real issue. That is because people with substance use disorder won't get the help they need because they fear how people will react. They fear judgment and how people will begin to perceive them. It may make them feel weak and embarrassed if they reveal what they are struggling with. And that is because of the widespread stigma that addicts don't deserve help because they either did it to themselves. That is the way many people think, and they are quick to criticize someone who is struggling with an illness. But the disorder can affect anyone. People shouldn't be so quick to judge because substance use disorder can develop due to a number of factors that also classify an illness. Addiction can develop in an individual because of genetic predisposition. Some people are at a higher risk due to family history and specific genes in an individual's reward system. A person's environment also influences this disorder. Early exposure to drugs, social and family environment, and even one's own financial status leads to many stressors in an individual's life and increases vulnerability. Finally, mental health greatly affects an individual's predisposition to develop substance use disorder. People with mental illness are much more likely to turn to drugs to cope with their symptoms. Both of these conditions feed off of each other and worsen the longer they are left untreated. Elizabeth Evans, MD, has some claims in an article claimed substance use disorder go hand in hand, both must be addressed, published by Columbia University Department of Psychiatry. The claim is that substance use can worsen the course of another mental health condition, and untreated mental health concerns can increase the vulnerability to substance use or developing a substance use disorder. In the article, it is also said that treating both conditions simultaneously can be extremely beneficial. Mental illness has been much more accepted in more recent years, and treatment is highly supported by many. Substance use disorder is no different and should be treated with the same level of understanding. Another point I want to make is that current medication for addiction treatment, while it has been proven to help, it is not administered the way it should be. In many cases, treatment for substance use disorder will include medication to help ease symptoms of the disorder, but this should never be the only form of treatment. Medications such as methadone or buprenorphine are used to treat opioid use disorder and helps mimic the effects of opioids in a safer and controlled manner. Many treatment centers administer this medication and close the case for an individual. In reality, this is just replacing an addiction with another addiction. It is proven to help, yes, but after administering this medication, long-term follow-up care should be provided along with other counseling methods to help an individual deal with the problems at the source of their disorder. Also, these medications can be expensive and hard to access. Once someone can afford this medication or isn't able to find it, chances of relapse increase drastically. The medication also comes with its own set of symptoms. Basically, people will still be addicted to something, but only this time it is administered by a medical professional. Therapy should become required with the administration of this medication in order to target the factors causing the addiction. So what else can be done to help people struggling with addiction? Current treatment for substance use disorder needs to be improved and more attention needs to be given to this issue. More individualized treatment plans should be developed in order to guarantee a person's recovery. Treatment should receive more long-term follow-up in order to prevent relapse. The use of medication also needs to be improved. Medication should be used along with other forms of treatment and never on its own. Finally, the most important solution, society needs to change their view on substance use disorder. People with this disorder are struggling and shouldn't be criticized or dismissed. Every human has an amazing potential, and these people are no different. People should be more compassionate to these people and recognize the potential in treating them. these are my flashcards.